Specs removal is a safe, painless 10-minute procedure. Basically, there are many benefits of removing glasses. They can sometimes affect your personality or looks and may cause discomfort or even headaches. An average person spends 2 to 4 lakh rupees over a lifetime on glasses or contact lens. But modern specs removal methods give you freedom at just 1/3 of that cost. It's a very common procedure and can be done after the age of 18 years. There are two main treatments for removing glasses, LASIK and ICL. LASIK is where a laser is used to correct the shape of your cornea. ICL, where a special lens with your glasses power is implanted inside your eye. Let's now discuss both in detail. LASIK eye surgery is best known and most commonly performed laser refractive surgery for removing glasses. In a normal eye, light passes through the cornea and reaches the retina. But if the shape of your cornea is not correct, the light doesn't reach the retina properly, and that's why we need glasses. In LASIK, laser helps reshape the cornea so that light reaches the retina directly without needing glasses. LASIK surgery can be of two types, flap-based and flapless methods. Flapless methods can further be of two types, surface ablation technique and lenticule-based methods. Let's first come to the surface ablation technique. In surface ablation technique, the laser reshapes the cornea directly. These are considered among the safest LASIK procedure, especially for people with thin cornea, those doing intense physical work, or those with pre-existing eye conditions. There are multiple techniques under surface ablation methods. The first and the most basic flapless technique is PRK, where the outer corneal layer called epithelium is removed using chemical solution, and then the laser reshapes the cornea. It's a low-budget option, but recovery is slower, and 100% vision may take 3 to 6 weeks to come. Topo-guided PRK is a modified version of traditional PRK. In this procedure, along with removing the glasses number, corneal polishing is also done to achieve better vision clarity and high quality vision. The cost of this procedure is around Rs 25,000 per eye. A similar procedure to Topo-guided PRK is Epicon Dora, in which about 22,000 points of the cornea are studied to precisely remove aberration and enhance vision quality. Next comes TransPRK, which is one-step, touchless, bladeless and flapless procedure, making it minimally invasive and highly advanced. In TransPRK, there is no need to even touch the eye. The patient is positioned under the laser light and the entire treatment is completed in a single step at a push of a button. Since no cuts are made, treatment is extremely safe and finishes in under 5 minutes. In TransPRK, over 1 lakh points are studied for aberration removal and polishing, giving most patients supervision, that is, vision better than 6x6. This procedure costs Rs 30,000 per eye. Next is SmartSurf, which includes all TransPRK features plus several advanced features like 5D eye tracking and dynamic cyclotorsion. The machine adjusts every second to your eye movement during surgery, increasing accuracy, especially for people with cylindrical power. All calculations are fully automatic, from pentacam scanning to machine data entry, eliminating human error. Cost of SmartSurf is 37,000 per eye. Lastly, in 2025, a new and advanced flapless procedure was introduced, CustomEyes. CustomEyes with Foresight is an upgraded version of SmartSurf. It uses AI-based ray tracing treatment planning. This software creates a 3D map of your eye using ray tracing and calculates results for every possible treatment, then recommends the best one. This means both doctor and patient can visualize the post-surgery result even before the surgery and select the ideal treatment accordingly. This gives unmatched vision quality. Most patients achieve 6x6, 6x5, 6x4 or even 6x3 or better. Compared to any other machine in the world, CustomEyes provides a smoother corneal surface for best clarity and maximum tissue saving with low energy pulses. So this means if your cornea is thin and some doctor has told you LASIK is not possible, it may still be possible with CustomEyes. It is also beneficial for patients with high eye power, since it's a completely touchless and bladeless process and uses AI planning. CustomEyes is currently the safest specs removal procedure in the world. The cost of this procedure is 47,000 per eye. These were the flapless surface ablation technique. Now let's discuss flapless lenticule-based procedure. In this method, a femtosecond laser creates a small dish-shaped tissue called lenticule inside the cornea. This is removed through a small incision, reshaping the cornea and improving vision. The most advanced lenticule-based technology in the world is ClearNeo by Zimmer, a trusted and advanced Swiss laser system which is FDA approved. EyeMantra is the only hospital in North India to offer ClearNeo. ClearNeo is a new and improved laser surgery compared to older lenticule procedure like CustomEyes. It uses ultra-low energy of 2 to 4 nanojoule and nano-sized laser spots, which makes the recovery faster and painless. It uses customized energy for each patient, improving vision clarity. The biggest advantage is no dryness after surgery. You start seeing clearly the very next day and can resume your daily routine immediately. The cost of this procedure is Rs 60,000 per eye. Lastly, let's come to flap-based procedure where a thin flap is created on the cornea, lifted, and then laser reshapes the cornea underneath. The flap is then placed back. Flap can be made using a blade or femtosecond laser. Popular blade-based flap procedures are standard LASIK, C-LASIK, and Contoura vision. When a blade is used, a flap can be irregular and complications like incomplete flap, flap dislocation, or buttonhole flap can occur. That's why nowadays femto laser is preferred for making the flap. It's safer and more precise. At EyeMantra, we use femto technology in CustomEyes Pro. This combines customized personalized features with Zimmer femto lasers, low energy and high precision, reducing flap-related complication. The cost of CustomEyes Pro is Rs 47,500 per eye. But generally speaking, flap-based procedures are less preferred nowadays because once a flap is created, it never heals completely. If your eye is accidentally injured even by a child's hand or pencil, the flap can dislocate, leading to vision-threatening problems. We regularly treat patients who have had such issues after flap surgery. For this reason, EyeMantra does not recommend flap-based procedure like standard LASIK, Contoura, or WaveLight in our eyes. If we talk about technology popularity at EyeMantra, 35% of patients choose CustomEyes, 30% go for SmartSurf or TransPRK, 25% opt for ClearNeo, 5% choose CustomEyes Pro, and 5% prefer PRK. Now, LASIK may not be suitable for people with power more than -10 or very thin corneas. In such cases, ICL becomes a great alternative and equally popular specs removal method. Think of it like a contact lens that is permanently placed inside your eye. It doesn't move, doesn't get damaged, doesn't need replacement, and you don't even feel it. It instantly corrects your vision, painless, touchless, with almost instant recovery. Plus, ICL is reversible. The only drawback is that it is more expensive than LASIK. In ICL, doctor takes exact measurement of your eye, length, width, depth, and order a custom lens. It takes 5 to 10 days to manufacture and deliver the lens. Once received, the doctor inserts the custom lens into your eye using an injector. This lens provides HD vision. There are two popular options. First is Star EVO ICL, one of the oldest and most trusted brand. Available in 4 size, corrects up to -18 power and requires a 3 mm incision. The cost of this lens is Rs 80,000 per eye. Second is IPCL, custom designed for each eye. Not limited to just 3 to 4 sizes like Star, but available in all sizes. Corrects up to -35 power and requires only a 2.2 mm incision. This lens is also available in 2 versions, the budget version costing 50,000 per eye and premium version costing 75,000 per eye. Premium IPCL includes 6 fixation points, spring-based haptic pads for better lens stability, and conical holes for reduced halogen glare with clearer vision. In terms of popularity at EyeMantra, around 65% of patients choose IPCL and 35% choose Star. So if you're planning for specs removal, both LASIK and ICL are excellent options. They are safe, painless, offer fast recovery, and are available at EyeMantra. The best procedure depends on your eye power, lifestyle, corneal thickness, and retinal health. Now you might be wondering which procedure is best for you among all these. If you're low on budget, go for PRK or TransPRK. CustomEyes is best if your power is less than 6. You need 6x6 vision for medical exam. Your cornea is thin or you have a lot of physical work. Clear Neo is ideal for high powers if you experience dryness or want fast recovery to resume daily routine the next day. Finally, ICL is best for people with power above -10 or very weak cornea. But the right decision can only be made after consulting an experienced eye surgeon. The doctor will assess your eyesight, corneal health and lifestyle to recommend the most suitable procedure for you. If you also want to know the best specs removal for yourself, call our helpline number and book your free consultation. If you still have any doubt, you can write us in the comments.